Hey guys, it's Dr. Savy from Blossom Family Chiropractic, and today I wanted to talk to you guys about ear infections. As you know, it's December right now, and it's considered the cold and flu season. So we're seeing more and more kids come in with ear infections. And I wanted to kind of talk to you about what ear infections are and a natural way to actually get rid of these. So, when ear infections occur, typically it's going to occur during the cold and flu season, quote unquote. And the reason for that is because we're eating a lot more sweets, a lot more sugar, and a lot more grains, right? Which are all inflammatory to our body. That produces excess mucus that then drains into the eustachian tube. Now, there's a muscle surrounding the eustachian tube called the tensor veli palatini muscle. And this muscle kind of acts as the esophagus does. It opens and closes, right? When we're trying to eat food, the esophagus opens and closes to push food down to our stomach so we can digest it. The tensor veli palatini muscle surrounding the eustachian tube does the same thing. So it opens and closes and opens and closes to push fluid out. Okay? Well, what happens is if the top bone in the neck is misaligned, it places stress onto the nerve that innervates the tensor veli palatini muscle. So what happens is that muscle spasms and it no longer opens and closes anymore. When it spasms like that, all of a sudden the fluid can't go anywhere. It can't drain. It's a plumbing problem, right? So our whole goal is in the office, chiropractic is very, very, very effective in getting rid of ear infections in kids and preventing future ones from occurring. See, what happens is we take the pressure off of that nerve to get the muscle to function properly so it can open and close and do its job like it's supposed to. All right, so that's our whole goal. All of these kids that are prescribed multiple rounds of antibiotics, that is actually not only treating bacterial infections, not necessarily viral, when most ear infections are viral, but it's also hurting the gut and making them more prone to ear infections. The American Academy of Pediatrics actually recommended back in the 80s and have kept their stance on it since, a watch and wait approach to ear infections. They said that pediatricians should not be prescribing antibiotics, yet we see that all the time. Also, a lot of times after multiple rounds of antibiotics, we see parents move to tubes. Now, a tube is drilling that hole through. Yes, it gets it to drain. However, what happens is because that muscle, tensor veli palatini muscle, is still spasmed, it didn't get to the root cause of the problem. So that spasm muscle actually pushes out that tube, and then we see recurrent ear infections or multiple tube surgeries that these kids are going through. So if you're looking for a natural approach to not only getting rid of ear infections, but also preventing future ones from occurring, check out our office. We're in downtown St. Petersburg, Florida at Blossom Family Chiropractic. If we're too far for you, reach out to us anyways, and I will definitely find a wonderful pediatric chiropractor for you to get in touch with. And that way we can really get these kiddos back on the right start to life. If you have any questions, reach out to us, blossomfamilychiro@gmail.com, or you can check out our website, www.blossomfamilychiropractic.com. Thanks so much. Until next time.